Hello, kidney warriors. James here from Dadvice TV, your online kidney health coach. And this is Dadvice TV Live. If you're new, go ahead and say new in the comments like Anita here. That way we can get to meet you and introduce ourselves. You're going to find our community is awesome, extremely supportive, extremely positive, and extremely helpful. Now, for you, those of you that are new, let me quickly introduce myself. My name is James. I am not a doctor. Nope, sorry. I'm not a renal dietitian either. I'm just a regular person who happened to end up in the ER and spent a week in the ICU where I discovered, out of the blue, I had kidney issues. And I just didn't have kidney issues. I had stage 5 kidney failure. Now, while I was there, the doctors got my GFR up and stable to 13 and said, James, that's as good as it's going to get. You need dialysis and you're going to need to get a transplant. Well, that was almost 2 years ago. Next week, it'll be 2 years. I never went on dialysis. I never got a transplant. What I did was I worked with doctors and I learned so much about kidney disease, about nutrition, about being active and healthier. And I was able to improve my overall health and my kidney health. Now, my kidneys are not better. They didn't heal themselves. There's no magic pills, no magic formulas, no magic herbs, none of that stuff. All that stuff's fake. What you can do, though, is reduce some of the burden on your kidneys. Be healthier, not loading down with sodium and potassium and all these things that are just wrecking havoc on our kidneys. Now, I remember I told you, the doctor said as good as I was going to get was that GFR 13. Well, I flew past that. I got into the high teens. I went through all the 20s, and over the last 2 years, I got up into the low 30s. But more importantly, because I don't really care about my GFR, is that I do not suffer a single symptom, and I have tons of energy, and I feel great. My kidney disease is not holding me back. Now, the key to all of this has really been education, working with renal dietitians, and every time I have a doctor visit, I have a ton of questions. I use my doctor visits to get as much as I can from my doctors and to talk with us about that. We have our favorite nephrologist back again, Dr. Qasim Butt. Hey, Doc, how you doing?
What's up, guys? What's up?
Woohoo! Introduce yourself for those that are new.
Well, I'm Dr. Qasim Butt. I'm a nephrologist. I'm a little different of a nephrologist. I do a lot of social media. I do videos, educational videos, to make life simpler for you guys, to explain things in simple, common sense language that you guys can understand. You can find me pretty active on Facebook, LinkedIn, YouTube, and my channel's called Your Kidneys, Your Health, because I really believe it's your kidneys, your health. You got to take control of your life, and that's why I wanted to do this show with you today, man. So I can we can kind of go over how you guys can take control.
All right, now let me switch over here so we're both on the screen. I keep rearranging my computer desktop and I forget where I put all the new buttons and stuff. So for most of us, when we get diagnosed, the first thing we do is we hear we have kidney issues. We go to the internet. And I'm going to tell you guys, those of you that are out there new, I know you're going to do it. I did it. But Dr. Google, Nurse Facebook, they are not your friend. It's going to come across as all doom and gloom. Do this, do that. We all are a little different. And what works for one person, even if your labs look identical and you have the same GFR, are not always going to be the same for you. What I do is going to be different than what you need to do. But the way to find out what those differences are, it all comes down to working with your doctors, asking lots of questions, and kind of knowing what questions to ask. So I'm going to pass it over to you, Doc. You are on the other side of the table. You're the one kind of who knows, hey, here's the information you need to know. And sometimes we're not ready to take it yet. But how do we get the most out of our appointments?
So the way I would like to take it is you gotta look at it before you go to the doctor, how do you prep yourself before you go, and how you do when you get there. Okay, so that's how I want you to know, so that you can have a nice streamlined interaction with that doctor. So what I would do is first know yourself, right? So you got to know your own medical history. Okay, so you got to be honest with yourself. Have you had diabetes? Have you had high blood pressure? How long have you had those diseases? Because the duration of how long you had those diseases affects how bad your kidneys are working. So you got to know your history very well, because the doctor is going to ask that, and you got to be honest with them, and let them know that. Now, what I've seen some really good patients do is actually write it on a piece of paper, type it out. And James, I feel like you're one of those suckers, aren't you?
I kind of write it.
Oh my God!
Not only do I write down all the questions, but I get my labs 2 to 3 days before my appointment.
Oh man!
I look over my labs and I type up all the questions I want to ask, and there's where Google comes into your friend. I'm like, whoa, sodium's too high. What is it? Maybe why do I maybe need to do? So I write a question. Should I do X, Y, Z? I email those to my doctor before the appointment. And when I come in, I have my printout and a pen, and I start writing the answers. And it's very effective because we do it.
It is.
Do. And they know what I'm concerned about. And they may say, hey, James, these 4 questions here, don't worry about it. That doesn't matter right now. We're focusing on this over here.
Yeah, no, and that's awesome, and that's one of the things on my list, to be honest with you, writing down the questions before you go in. But before even the questions you have for these for the patient, before the doctor, I would start off knowing yourself. So you got to know all your medical history, know your surgeries, every little surgery you've done, your allergies and medications, those kind of things. Also, you got to know your family history, dude. Family history. It's kind of important that, we know that your mom and dad had kidney disease, or, I'm in San Antonio, and we literally have brother and sister teams on dialysis. We actually have husband and wife teams. We have mom and dad's, mom and son teams. Like, it's weird, but your history does matter. So you should know that, or at least, express it when you get there, and make sure you know that. Now, as far as other things, again, know yourself, right? I'm a big fan of you bringing in your medications to the appointment with us. Now, you like writing stuff down. I honestly don't trust lists. I don't trust lists, and I don't trust your memory, okay? Irrespective of who you are.
So my meds are in an app.
Oh, and like yourself, to be honest with you, a patient like yourself, James, I agree. You probably are on point with it. But, oftentimes they'll say they're on a medication.
I can't remember them and the dosage.
Yeah.
So I use an app that reminds me, and it bugs me like so much that you cannot miss taking your pills. My watch, the phone, the computer, it's sending me emails if it's been an hour and I haven't said that, yes, I took it. And I go over that. Every visit, that's one of the first things we do. Are you still taking this time, anything new? Blah, blah, blah. Knowing.
So if you're someone like yourself that keeps a very accurate detailed log, unfortunately, I want to say 80 to 90% of people aren't that. Mm-hmm. So oftentimes I actually have them bring in the medications, and you find a lot of discrepancies because sometimes the pill box says twice a day on it, and these patients are taking it once a day. So it's kind of crucial that, if your blood pressure is not controlled and you're on a blood pressure medication that's supposed to be taken twice a day, you're only taking it once a day. If I up it, I'm going to be maybe hurting you by accident because you're not taking it in the first place. Okay. Now, as far as other things about yourself, take blood pressure logs of yourself. And I know you do this, James, right? You take your blood pressure logs.
Again, sync to the phone.
Yeah. And so there are great home blood pressure monitors. By the way, I did make a video on this, how to take your blood pressure at home. And I go over what kind of machines you should get. I'm not going to, tell you any specific brands right now, but, monitor those blood pressures at home. Keep a log either on your phone or a piece of paper. Some of you guys out there, I know you're not tech savvy, but keep a nice little log, Excel spreadsheet or something to where, we can actually monitor it. And that way, when you bring it in, I'm not getting that one reading of a high blood pressure because you're nervous because you're seeing me for the first time. Do you see what I'm saying? It's good to bring in that whole list. And that way, okay, you're 120 over 80 most of the time, but today you're 150 over 70. You're just nervous seeing me for the first time as a nephrologist, okay?
Yeah,
And oh, by the way, Dawn just. Oh, go ahead. Go ahead.
I was gonna say that white coat, fear
Yep.
is true. I don't get that from doctors, but I do if I know they're going to make me stand on the scale. My blood pressure goes up. If my doctor knows, he tells me, okay, I'm not going to make you stand on the scale. Come on in.
Yeah. Well, white coat hypertension is real, guys. People get scared. So I hate adjusting medications just for the sake of adjusting medications for a number. I want to know what's going on with you at home. Okay. Mm-hmm. Now, this is similar for if you're a diabetic as well, too. If you're a diabetic, take your blood sugars at home and monitor those. Keep a log. Bring those suckers in. That way we can tell, hey, this lady's blood sugars is controlled. It's, diabetes, because diabetes can progress kidney disease. That's very important for us as well, too.
Yep. Now, I'm checking on a few people said the video is not coming in, so I'm going to check on that real quick. One thing you did mention earlier, I wanted to emphasize, be honest with your doctors, everybody. In the beginning, there were symptoms I had that I just felt, hey, this is kind of gross. I don't need to tell the doctor, When I go to the bathroom, there's blood coming out and stuff like that. Or how I exactly felt, like the metallic taste in my mouth, the fatigue. I just kind of thought, I'll get over those. And that delayed diagnosing that I had a more serious issue, being in kidney failure. So always make sure you are honest and tell your doctor everything. If something seems abnormal, mention it to them.
That, James, that is so crucial. That is so crucial. There's so many men or so many people in general, but so many men, older men, are in denial about everything. And so they will not tell you that they're having chest pain or that they feel weak or tired. Now, the other component of being honest is be honest about if you're taking your meds, people. Like if you're not taking your meds and your blood pressure is high, your blood sugar is controlled, let us know that. And that way I can document in the chart and talk to you about compliance and doing that. Because again, if you're on 3 blood pressure medications and your blood pressure is not controlled, I don't want to add a 4th agent because God forbid you take up that 4th agent. Yeah, I may tank your blood pressure because you weren't honest that you were taking the first 3 in the first place. Do you see what I'm saying? Mm-hmm. So again, that honesty and that communication is so crucial. And again, that way I can document in my notes that, hey, the blood pressure is out of control because the patient's not taking it correctly. I'm going to counsel him about, to compliance issues and taking it properly. So.
Yeah, and my doctor knows if I'm not being 100% honest. He'll say like, "Hey, stick it to your diet. Are you exercising and losing weight?" And I'm like, and he knows right there that little delay. Don't lie to me. That's what he'll say. I can tell you can't lie to the numbers.
So James, I actually get crazy excited when a patient tells me they lose 10, 15 pounds. Like I had a patient today, a new patient in my office, and he told me he lost 15 pounds on his own, was referred for me the first time. And I was like super excited for him. And I tell all people this, like you losing 10, 15, 20 pounds is probably doing more for you than any medication I could ever give you. Mm-hmm. So, that's very inspiring when we hear that. It's very motivational for us saying, hey, we're going to make a difference in this person's life. And that person is going to make a difference in their own lives. So.
Yeah, that's something I definitely got to get back on top of. I'm on the opposite. I've gained a few pounds.
Oh, is that right? Now, by the way, there's a girl on your comments list that came up, Dawn.
Yeah, Dawn.
Dawn Gardner. She's bringing up my next point. My next point
was.
Was.
Back and bring it up here. Here it is. This one.
Yeah.
Boom.
Yeah.
That comment?
No, because my insurance does not pay for renal dietitian.
Oh,
no. There was another Dawn.
There's another one. Oh, here it is. This one. It was right before that.
There you go. Dawn Gardner. Yeah. My number said to go to the National Kidney Foundation website. I highly recommend that for everybody, okay? We're talking about Dr. Googles and Facebook nurses and all this kind of stuff. Go to reputable websites. And a reputable website is the National Kidney Foundation. They have excellent patient resources for you guys, okay? So I think that's very important that you guys get educated properly. And you know what? Know the terms. So that way you're not overwhelmed with new terminology when you go there. And so you learn what EGFR is, creatinine is. I actually just released a video on that today. But you need to know those terms. That way when you go there to the doctor, you know what he's talking about and it's not completely overwhelming. Oh, Dawn here says losing weight has helped her in many ways. That's awesome.
Yeah,
that's awesome.
A lot of people have mentioned they're commenting about losing some weight and it's helping. It's funny. It's one of those things that we kind of have control over. It's not easy, but but we could be a little more active, watch what we eat, and hopefully start whittling away at that extra weight. My problem right now is all the snacks sitting around the house. It's so easy to walk through the kitchen and take a quick little bite of something. Like, oh, that's not going to hurt.
Oh, yeah.
But they add
and that's
up
what gets you,
throughout the
dude.
day.
That's what gets you. You know, like if you have an office worker, I'm a guarantee y'all got a snack. You got a drawer for the Skittles, right? and so you're opening that drawer and like, hey, just taking that snack. And unfortunately, so many people, like when I talk about diet or something like that, they're not honest, or they don't even in their heads count those little snacks. That Snickers bar adds up. They add up. That's 200, 300 calories right there, dude. And so you're keeping on ingesting that many calories. So again, this is where the honesty really is important. I've heard people tell me I've tried to lose weight, but in actuality, they haven't really tried to implement changes. They're just saying they are. So, I would love to, most of us as doctors love to work with you guys and make sure you are making those right choices. But again, I think just look for good resources. The National Kidney Foundation has really good resources, and if you are in that late stage kidney disease, they can talk about kidney diets and stuff like that. And you can get familiar with that stuff. So,
now if someone's brand new, they just got diagnosed, because I saw a bunch of people today on Reddit that were saying, "Hey, I just found out I have kidney problems. I have an appointment. What questions should I ask?" What are the right questions they need to ask their nephrologist?
Okay, so what I would start off with is, let's just go off the basic stuff, right? So first I would ask, why was I referred here? Okay, so what I mean by that is, was I referred here for high blood pressure to the kidney doctor? Because you can refer for that. Was I referred here for decrease in kidney function? Was I referred for that? Was I referred for high levels of protein in my urine? Was I, is that the reason? Was I referred for blood in the urine? So you want to know why you were referred. Now, let's just say you were referred for kidney disease. That's just kidney disease itself, or decreasing kidney function. What I would ask them to do right away is, okay, what's my creatinine and what's my EGFR? Those are two things you should know at every doctor's appointment with your nephrologist. Every single time, you ask them, what's my creatinine and what's my EGFR, and pull a James, guys, pull a James, write it down. Write it down.
Write everything down, and if I can. I turn on my phone to record the audio in case I miss something. They don't always like that, because you got to ask for permission.
Wow.
And I'm always asking those questions that kind of push it a little too far. I'm like, come on, doc, I know you can't give me a number, but let's just say for giggles, what chance do you think I have of getting to this by this period of time, or something like that? And they're like,
oh yeah. And unfortunately, we can't really answer that sometimes. We can have a general idea that it could possibly improve or decrease or something, but I can't tell you by 6 weeks out your kidney function is going to be back to normal. So
yeah.
And the other thing I would
their creatinine, their EGFR. What else do they need to know?
The other marker you guys should really know is your protein in the urine. Okay, that's another one that I think you guys should follow, because the more protein loss you have in your urine, the worse outcome you're going to have with your kidney function. Okay, so in a normal day, myself as a person with normal kidney function probably loses anywhere from 150 milligrams to 200 milligrams of protein in the urine or less. Okay, so let's just say, for argument's sake, like less than 200 milligrams of protein or less. If you're above that, you're in what we call macroalbuminuria range, where you're losing a decent amount of protein in the urine. Okay, so if the more you go up from that, the more chances that your kidney function will continue to progress downwards. Okay, and if that happens, if you do have a lot of protein in the urine, you got to ask, am I on any medications to decrease the amount of protein? Okay, and that's the other thing I would ask as well too.
And what kind of medications might help reduce protein in the urine?
Well, we've talked about this before, James. We were talking about ACE inhibitors, and which are end in pril, like lisinopril, enalapril. Then you have the ARBs, which end in artin, losartan, valsartan, those kind of medications. So you've got to make sure you're on those medications. Okay. Now, as far as other things, if it's like we were just talking about being the first appointment, you're going to ask them, hey, are we going to get a renal ultrasound, a kidney ultrasound? Okay, so the whole point of a kidney ultrasound is to see if those kidneys are nice and juicy and plump, or are they small and shrunken like prunes. Okay, if they're small and shrunken like prunes, that's meaning your kidney disease is late stage versus just maybe a newly diagnosed one. Okay.
Yep. I remember the ultrasound. I had an endless dry cough. I could not stop coughing for more than a few seconds, and it was so difficult to get that ultrasound. And I kept apologizing, saying, I tried not to cough, because I couldn't hold still for them. But I remember getting mine.
And also, with the kidney ultrasound, we're looking for, if it's nice and healthy, you may want to ask your kidney doctor, do I need a kidney biopsy to figure out what's going on? And this is where knowing your medical history is crucial, because if you're diabetic for 30 years and have what we call neuropathy, which is nerve tingling, or, have vascular disease or eye problems because of the diabetes, chances are clinically I'll diagnose you with what we call diabetic nephropathy or diabetic kidney. Okay. So I'll probably clinically do it. Now, if you have significant amount of protein or significant amount of blood in your urine, they may go in for what we call a kidney biopsy. And so that's literally when they take a needle, stick it in your back, get a sample of that kidney out, and then look at it. Not everybody proceeds to that. It depends on their clinical history and depends on the other labs that we've gotten, especially those autoimmune markers where you're looking for any autoimmune disease. So if any of those markers come back positive, the clinical history is kind of weird, or you're losing a lot of protein in the urine, we may just go for a kidney biopsy. So that's another thing you may want to ask the kidney doctor. Do I need a kidney biopsy?
Yeah, and that was one of the things I got lucky not to need. They thought they were going to do one in the beginning, but I ended up, we talked about it, and they had a good idea what the problem was. And I asked, how's it going to change my treatment? And they said, it's not. They'll just answer a few more questions. I said, okay, I don't want to do it.
Yeah.
It just didn't sound like something I wanted to have done. With all the
it's
other
not
issues
fun. It's not fun. I'm not going to say it's fun. Now, I only offer to those I think are absolutely needed. Those 70, 80-year-old patients, I'm likely not going to do it for. I'm just going to kind of do conservative management. But if you're 30, 40 years old with a relatively good history and your kidney function's down, I may just do it to figure out what's going on with you, because it may be reversible. So again, it depends on your individual circumstance, but definitely ask your doctor if a kidney biopsy is needed in this scenario. So
now Natalie has a great question I hear all the time. Can a kidney biopsy cause more kidney damage?
Ooh, excellent question. Yes, it can. And so there's some factors where you would be inhibited in doing it, in the sense like, remember we're looking at those kidneys to see if they're nice, juicy, and plump. If they're nice, juicy, and plump, guess what? I can go in there nicely, get a little sample out of that kidney, bug up. Your kidney heals up real good. That little spot where we make a little blood clot may form right there. Close up though, and you're done. Now, if the kidneys are small or too small, they may be what we call sclerosed, or have a lot of fibrous tissue there, so they're scarred up. So if I stick a needle in that scar tissue, it may not heal right, and you may develop what we call a hematoma, which could develop a big clot back there. Also, let's just say there's some people where they're born with one kidney is just tiny. They were just born like that. Right? Like it's called atrophy. So one of their kidneys just never developed, or for some reason didn't develop, and you have a nice healthy kidney. I would be apprehensive about biopsying this healthy kidney. Just because, God forbid, there was a complication, I may knock it out. So again, yes, it can. It's rare. But that's where we do the ultrasound to make sure the kidneys are healthy before we do it.
Yep. Anything else for those that are fairly new, their first visit or their first couple visits?
First visit, other than that, so before we even get to the doctor, what I would do, honestly, and I'm a big fan of this, is I don't mean playing Dr. Google, but I think you should look up reviews of doctors online, particularly at websites like Health Grades, Vitals, even Google and Facebook. They and even Yelp sometimes has reviews as well too. But sometimes you get referred from your PCP. You don't find your own kidney doctor, right? And so if you want to look that up, you can look it up and see. Maybe there's a video out on that person. You can actually take a look to see if you personalities match up. A lot of people may want like a Spanish speaking doctor or like a certain language. So that's a big deal too. ages, I think that some people connect better with their own age group. If you're in your 40s, you may connect with someone better with someone in their 40s. If you're in your 60s, you may connect better there. Now, some people don't care, but these kind of attributes I think are big deals. So Google them just to make sure they are legit and that you think you'll get along with them, because I really believe in having a good relationship, the patient doctor relationship. It's kind of crucial to the care. So I think that's something I would definitely look out for.
Yeah, and that relationship, all of my doctors, I know them so well, and we just kind of click, and that allows me to feel more comfortable to be honest with them, and they can be blunt with me. They're like they'll say like, James, don't you dare try that supplement. No, they're just blunt. Instead of saying, well, there's no data showing that works. Well, no, they're right to the point with me, which is great, and I love that.
Yeah, no, that's awesome too. And the other thing I would definitely say is just with that relationship, make sure the doctor explains to you what's going on. And if he says something or she says something that's kind of off or you don't get it, don't do this. Don't do this. I hate that. That's a sign like that's like I'm not paying attention. I'm just like, okay, ask the question. Hey, doctor, what's an EGFR? Tell me what that is again. Hey, how much protein am I losing? If he says something or she says something that's the word doesn't make sense to you, they're using some big word, ask him to say, what does that mean? And do not be afraid to ask that question, okay? Just to say, what does that mean? That way you leave with an understanding. That to me is like, if you don't go there, and get anything out of it, what's the point of even going, right? And so that's my whole thing. You got to remember, we're not your we're not your principal, we're not your teacher, we're not your mom or dad, right? I'm your consultant, right? So you have to ask me everything you need to know to improve your own life. I can't improve your life for you, so I can only suggest things. So that's where I think the communication and you questioning, do not be afraid to question them. And once you get a good relationship with that doctor, guess what? You can answer any questions, So.
Yep. Now, what if they don't feel comfortable with their doctors? I do see a lot of people that'll say, hey, my doctor doesn't answer my questions. For some reason, the relationship and the communication just isn't there. How do you recommend they move forward? Should they tell their doctor that?
So this is a weird thing. So you can start with the doctor and say, hey, this is not working out, or how can we have a better communication? You can have that conversation with that person. But, I've seen a lot of patients almost feel like they're stuck with a doctor because he's my doctor, and they have my records. My mother-in-law, actually, before she passed, had a cancer doctor, and he was horrible, and she didn't like him, but she didn't want to leave him because he had her records. You know what I'm saying? And I'm like, no, you can move. They can
share them. They can send them.
You can share them. They can send them. So I would definitely recommend, if you don't like your doctor, I don't think doctors are commodities. Do not get me wrong, but there are other what's the word here? There are other fish in the ocean, I guess. So you can look online, find another doctor, and make sure that doctors within your insurance, covered by your insurance and everything. But once you get that, once you don't get that from your doctor, look for a new one and see if that you can find someone there. And I actually recommend, look with those reviews, see if you like those reviews, but also word of mouth. Other people, but you'd be surprised. A lot of people have kidney disease, and so look around and ask them, hey, who do you recommend? Who do you think you'd be a good doctor? So,
yeah, and I've definitely recommended my family doctor to so many people because he's so good. And he was the one when awesome. when the first nephrologist tells me, hey, you need dialysis, my wife went to see him because she had some stomach issues she'd been putting off, and realized, we got to get this straightened out. What if I died or something like that? She needs to be there for the kids. And he told her, tell James to see me as soon as he gets out. I can help him. Don't listen to that doctor. I know it's scary. He doesn't need dialysis. And I ended up not needing it. And his big focus was getting stress under control. Let's get your blood pressure under control. Learn how to eat. You got to go see a renal dietitian. Instead of just saying, hey, eat better, he said, you go see a renal dietitian. I'll help you get the appointment. Absolutely. You're going to do that. And we just kept working together. We had lots of checkups. He's like a coach, very motivational. and we'd call, touch on the phone, and he'd say, "Are there any questions, anything you don't understand?" And it was actually him who said to start doing this, recording videos, and he told me, make a journal of everything. You're gonna write a book. You're gonna get better, and you're gonna write a book, because he knew me. I said, "I'm not gonna write a book, Doc. I hate writing, but I love video." So I started making little videos, and now boom, here we are.
Yeah, well, awesome. Like he pretty much recommend you get your own YouTube channel.
Yeah, exactly. I needed a place to store all the videos. But it was that relationship and communication really that made all of this possible. And I just can't emphasize how important that is. And if I didn't have a great doctor, I'm the kind that wouldn't feel stuck, but I know a lot of people would. My wife would. She had a bad dentist, dentist, and a bad dental experience, and then she went back to him, and they were all bad. I'm the kind that would say, "Hey, it's time to change." I ask around, I look for referrals, and I give referrals. So if any of you out there have great doctors, share it. Let other people know.
Yeah, absolutely. So, I mean, that's a big deal, and then, also, when you're looking at these doctors and when you go to that first appointment, ask them, I'm not trying to discount like solo practitioners or anything, but ask them how many dialysis units do you have here? Where are your facilities? Do you have a home dialysis program? Different questions like that may help. Now, I've told you this before, James, like how you get treated for nephrology care or any care in America depends on your location. It depends on your city. It depends on the practice your kidney doctor is a part of. So, if you're in rural America, you may just have a solo practitioner out there and that's all he's got, or maybe none, or maybe he's 200 miles away. But if you're in a big city, you have a lot more options. So, you may want to ask, what kind of facilities and amenities or, logistical support these people have. Do you have a renal dietitian that I could see? You have an educator I could see? Those kind of things really could make your experience a lot better,
Yes, certainly. Now, my doctor, my primary one, he runs out of a tiny little house. He converted to his own little private practice.
Yeah.
His wife
There's nothing
runs
wrong with
the
solo
front
practitioners.
desk. But I like him because I interviewed a lot of doctors when I relocated to Cincinnati to find one that I clicked with and one that wasn't heavy on medication. I just had this fear of coming to Ohio, and in my mind, every doctor was giving out opioids like crazy, like they're Tic Tacs. Yeah. And I didn't want to end up addicted to anything. That was just a fear I had. And I interviewed doctors, and one of the things I asked was, how do you treat medication? When do you prescribe it? And his response was, well, we talk about what you need, we give you what you need, and we have a plan to get off of it if possible. Something like
that's awesome.
Blood pressure is for a long time. Yeah. And that right there let me know, I like that. It made me feel more comfortable, which, made it easy to choose him.
Well, that is one of the biggest problems we have in healthcare today is polypharmacy, like having such a giant pill burden. One thing is it's just almost like taking a meal on itself every time you're taking your pills, but also it decreases compliance, right? So if you have to take more pills, you're less likely to have that patient comply with that many pills versus say 1 pill or 2 pills. So that's great that he has that philosophy, and again, that if you can meet it with lifestyle changes, that's awesome,
Yep. So anything else for the new kidney patient? Then we'll move into
the new kidney patients. Okay, so we talked about EGFR. We talked about creatinine. You also may want to ask them, is it worth it to do a 24-hour urine? And so a 24-hour urine, which is no fun at all. But
especially if you're going to work. Do it on a weekend.
So just so y'all know, a 24-hour urine is urine collected over a 24-hour period. You got to put it in a jug, and you got to keep that sucker on ice. Okay, so you got to keep it on ice. Now, the thing is, I don't do it for everybody. I only do it occasionally when I doubt the creatinine and the EGFR are accurate. And oftentimes in the very young or the very old or the very sick, the EGFR calculation is off. So you may want to do a creatinine clearance, which is the 24-hour urine collection, which will give you the most accurate assessment of the kidney function. It's the same number as a GFR, meaning it correlates directly with GFR. But it's better because it's actually testing your urine directly. And it also give you an accurate assessment of how much protein you're losing in your urine. So that's going to give you a more accurate than just a quick spot test that we do. A lot of the old school nephrologists do order them more frequently, but I take into account the fact that it's just a pain. And so I only use it kind of sparingly just to make sure we have a proper assessment of the person as well too. The other thing is that for the newbies, know your stage of CKD. Know your stage of CKD. So there's 5 stages, 1 through 5. 1 is greater than 90%. 2 is greater than 60%. 3 is large. It's actually divided between 3A and 3B, but between 30 and 60. CKD 4 is less than 30, and CKD 5 is less than 15. The other thing I'm going to ask you guys to do is less than 30. Make sure they start educating you on dialysis options, okay? So that's another thing. So if your GFR is less than 30, typically less than 25, you need to get education about dialysis options, okay? It doesn't mean you're going to be there. I've had patients with CKD4 with GFRs of 25 for like 5 years. I've had those patients, but I've also had patients drop off pretty quick. So you should at least get educated about your dialysis options, home dialysis versus, say, in-center hemodialysis, those options as well. And lastly, I think also when your GFR goes less than 20, again, this is in Texas, but I think it's kind of standard for all transplant centers. When your GFR gets to 20 or less, you can be referred to a kidney transplant program. Okay, so you can get on the list early. And some people actually get on the list early enough to where they can get a kidney before they actually need dialysis. Do you see what I'm saying? So they get to not ever have to do dialysis. So again, those two things for dialysis education with GFR in their 20s and transplant referral at 20 or less, I would definitely ask about that as well too.
And when should they be asking about access at what GFR?
So this is interesting. So we talked about this one time before too, because I'm actually an interventional nephrologist guy, so I actually do dialysis access. Now, typically they say GFR less than 30 is when you're supposed to get a dialysis access in you, okay, around there. Now, I actually rate for a GFR of less than, of around 20 or less, typically. And the reason why is because I'm in San Antonio. I'm in a pretty big group, 15 physician practice, and we have all interventional nephrology. We have a surgeon putting accesses in. So if I need to get an access in you quick, I can have that access in you in 2 weeks. Okay, but if you're in that rural center, in say Iowa somewhere, you're 2 hours from your doctor and 3 hours from the biggest city or something like that. That doctor may not know how long it's going to get that access in. So it may take, a month to get you the ultrasound for the access, then another month or two to get the fistula in, then it may mature, it may not mature. So typically GFR less than 30, you need to get your access possibly referred, but at least around 20, depending on where your location is and how comfortable your nephrologist is with your kidney function declining. And again, it's about how fast your kidney function is declining. If your kidney function is just kind of go doing this sucker over 5, 10, 15, 20 years, not bad. But if it's doing this number straight down, then maybe you want to get it in quicker. But typically GFR less than 30 is when you get that access referred for.
Yep. And speaking of that kind of trending, how often should I be getting my GFR checked and seeing my doctor?
Okay, so I'm just going to give you my thing. Okay, so typically CKD stage 2, depending on if there's a lot of protein or not. CKD stage 2, which is GFR greater than 20, I probably see you every 6 months. CKD stage 3, depending on how your electrolytes are and your edema and things like that are, probably every 3 to 4 months. CKD 4, I'm probably seeing you anywhere from 2 to 3 months. CKD 4. But if your GFR is less than, say, I want to say around 17 or 18 or less, I'm probably seeing you every month. And because GFR of 15 or less is typically when a dialysis is initiated, and you typically have all your electrolyte issues, you could have edema develop. So I'm probably following you every month or so. So around there, CFR less than 20, probably every month to 2 months. So that's where I would say it. But sometimes I have patients back in 2 weeks, depending on how they're doing. But yeah, somewhere around there. But it depends. You don't have to have it checked all the time if it's stable. But again, it depends on your stage of kidney disease, how often you should have it checked.
Now, is there anything that you wish all kidney patients knew? Like,
All
so
kidney
many
patients
come
knew.
in with certain misconceptions about things. Anything like that?
Ooh, one of them is I had this today. That kidney disease doesn't cause pain. Very rarely does it cause. I mean, it doesn't always cause pain. So you don't want to wait for problems to develop before you see a kidney doctor, or have symptoms before you see a kidney doctor. So that's one of the main things. Don't think, oh, my back is not hurting. Most back pain, 90% of the time, is just musculoskeletal. It's just back pain. But some people think, oh, it's my kidneys. No, I would say that's one of the things as well too. Not to wait for symptoms to develop before seeing a doctor. So make sure you're getting your checkup. And this is a whole thing now. You got to remember Medicare, when you had the Trump executive order. We've talked about that. But they're going to clamp down on kidney disease because kidney disease is costing so much. So the best way to clamp down on kidney disease is get screened early. So go for your annual appointments with your doctor, even if you're healthy. Get checked. Ask them to check your urine to make sure there's no blood or protein in it. Ask them what your creatinine and GFR is. Make sure those are stable, and those will prevent you from developing kidney disease, or at least give you a signal early.
Yeah, and I made the mistake, and I learned the hard way. I ignored symptoms. I had so many of them, and it started out with a simple one, then this and this. It's got more and more symptoms, and it got to the point where I had extreme anemia. I mean, my GFR was 8, so you can only imagine. The anemia was awful. My hemoglobins were so low. I was so tired. The taste in mouth, the headache, the coughing, sweating, unimaginable amounts at night, where I didn't even sleep on my mattress because I would just wake up and I would be like dripping. Like, what happened? Oh, it's just everything you can imagine I suffered from. And I didn't reach out to my doctor. I suffered for weeks with all those. Before it got so bad, I was like, oh, I'm going to go to my doctor. So don't hold back, people.
Oh, and that goes to your point too, because remember you were very anemic when you presented.
Oh, yes.
Ask about anemia. Anemia goes along with kidney disease, guys. So that's interesting. So people who have kidney disease oftentimes get iron deficient as well too. They get iron deficient, but also your kidneys actually secrete a hormone called erythropoietin that actually helps your bone marrow make blood. So as your kidney function goes down, your ability to make blood goes down. So ask your doctor, am I anemic? Okay, and what's my hemoglobin? And that's another one. The other one, we talked about potassium and phosphorus levels. You may want to ask about that as well too. Vitamin D. What's my 25 vitamin D levels? Vitamin D is common amongst all Americans. Okay, vitamin D deficiency, excuse me, it's common amongst all Americans. So I would definitely ask what my 25 vitamin D levels are for sure as well too, just to make sure that those are there too. So there's a little bit of a list of stuff there, but just knowing what to ask, and that's what we went over today. It's kind of crucial so that you have power over yourself. So.
Yeah, and we got a comment right here from Colette, which I hear quite often, where labs, show that they have some kidney issues, but their family doctor doesn't mention anything until it gets to, more severe.
So that's interesting. So what's interesting is the older school doctors, and I'm not knocking the old school doctors because I have crazy respect for them, what they've been through and their clinical knowledge and everything. But oftentimes they only refer when it gets late. So typically when the CKD4 or some arbitrary creatinine number in their head, like a creatinine of 2 or something, and then they say, hey, I'm going to refer you to a kidney doctor now. And oftentimes they'll say, I'll handle it. You see what I'm saying? The old school doctors are like, I'll handle it. Whereas the newer school doctors, and honestly, the way insurance companies and Medicare are going to address kidney disease now, they're going to insist that you get to see a kidney doctor early. So they want you treating kidney disease at CKD stage 3 or 3A as opposed to 4. And unfortunately, I oftentimes get patients with CKD 4 or 5, and I'm like, what do I do now? I'm like, I've had that conversation. Hey man, I got you with the GFR of 17. there's really ain't much I can do for you except for talking about dialysis right now. You see what I'm saying?
Yep.
Now I have fine-tuned their medications. I help make sure they're not taking anything bad, adjust their anemia and all that good stuff too. But I could do a lot more for that person if I got them at a GFR of 50 or 55 than I could do for them with a GFR of 17, right? And Medicare is going to change this with their reimbursement plans and how they're going to do this. They're going to insist that you send those patients earlier. And again, this is why we have this show, right? Where you guys can understand eGFR, creatinine, protein in the urine, and all this stuff. That way you can assess yourself, hey, do I need to see a nephrologist or not? So...
Yeah. Now we have a few questions from the audience. My throat is itchy today. I think it's because I was outside trying to clean out the garage so I can get my car in there. I now have a plug-in car that you got to plug in and charge. So I saw
that on Facebook. I
run the cable out into the driveway now, which I don't know if you can do it when it rains. So I unplug it at night. I don't think it's 100%. But anyway. Here's a few questions. Matt has one. I've seen him ask it a few times in Facebook. When he gets an IV, his GFR improves. But then when he's done with the IV, it goes back down. Is that normal? I've never heard of that.
Yeah, so this is interesting. So, there's two reasons why. One, I don't know you. I don't know him clinically. I don't know what's going on with him. But he could be someone that's chronically dehydrated, meaning he's someone that's not eating properly or just, has issues with, say, diarrhea, or some people who have colostomy bags. They have high output from them, so they actually get chronically dehydrated. And so by hydrating someone, you can you just reset their kidney function back to normal. So maybe that's a sign that he needs to drink more water. Now, the other thing is, that can happen is, I've seen this before, where a person goes to the hospital and they hydrate them up with fluids and their creatinine is like 0.6. But then when they get to my clinic, they're 1.0. Sometimes in the setting of in the hospital, when you get overhydrated, it artificially brings your creatinine down, brings your GFR up. Do you see what I'm saying?
Yeah.
Because you're overhydrated too. So hydrating yourself is a good thing, but again, with people with kidney disease, you can get fluid overloaded, where you get too much fluid. But I've seen people get hydrated, and that brings your kidney function down. That doesn't happen necessarily to everybody, guys. So this guy is particular to him. I don't know. He could be chronically dehydrated, and that's why the fluids help, and maybe him drinking more water will help.
Yeah, that's a great reason. Staying hydrated. Yeah, I didn't even think about that. That is great. Now, when I was diagnosed, like so many, we don't know until it's late, because we wait until the symptoms bother us, and then we go to the doctor. And from my experience, most of us are suffering from anemia. Are there certain questions or a certain approach that you take with new patients that are suffering from anemia to help them kind of get past it?
Yeah, so what I would start off with, so again, patients who have kidney disease are likely going to also have what we call an iron deficiency, right? Mm-hmm. So right off the bat, if you're anemic, you're going to ask the doctor, what are my iron studies like? Am I iron deficient?
Mine was way down.
Way down. So you also ask them about B12 and folate. Those are two vitamins.
Yep, those
so you want to make sure
also.
there's B12 and folate. Yeah, so you want to check the B12 and folate to see if those are down as well too. Now, depending on the stage of kidney disease, people with late stage kidney disease don't absorb iron orally very well. So pills don't work as well for them. Okay, it's due to the transport mechanism of iron from the digestive system into the blood. It gets off with people with kidney disease. So I could eat, a steak or spinach with a lot of iron in it, and I absorb that iron, but a person with kidney disease may not. So some people with anemia with kidney disease may need IV iron infusions. Okay, so it's a possibility that you may need IV iron infusion at an infusion center somewhere, but also they may just start a load of oral iron. Okay, of note, guys, if you take oral iron, it may cause constipation and it will likely turn your stool black. Okay, so if you pop out a black turd, it's after taking iron, it's probably the iron tablet. Okay, so don't be all scared.
That
okay?
is the first time that phrase "black turd" has ever been.
And that sounded like a South Park episode, right? But yeah. So that's the other.
Had me. Yeah, they put me on a diet high in iron, B9, B12. The folic acid, B12, a certain amount of vitamin C to help in absorbing those, and it took a while, but I got mine under control while also being more active. There was no one thing that did it. It was all like, hey, you got to get healthy. Get off the old McDonald's bandwagon. No more Burger King. No more Dr. Pepper.
Also, if you're late stage kidney disease like yourself, where you were, you may need shots of what we call an erythropoietin agent, like EPO. Yeah. So you may need like different types of that. So it's a shot. Essentially, it's the erythropoietin hormone. So you may want to get those. You may have to get those shots. Again, that's on your nephrologist to make that decision. Usually, they give you iron to see if it improves, and if it doesn't, then they may opt for that as well too.
Awesome. So I saw those are a few of the questions I saw popping up a lot. We are getting close to the top of the hour. Is there any other advice for getting the most out of our doctor's appointments?
It's just, I really believe it's the relationship. So if you like your doctor and they communicate well with you, that's going to be the key to your success, your happiness, and your improvement in your kidney disease. Even if your kidney disease doesn't improve, at least you have someone you trust and like. Like with healthcare, with especially this kind of disease, it's a chronic disease where you're going to be seeing this person a lot. You might as well like them. So if you don't like them, try to find someone that you do like. But again, from the other side, I know you guys out there, you guys have a hard time getting good doctors. But oftentimes I have a hard issue that a lot of my patients just don't listen to me. And I've talked to you, James, about that before. Yep. So it's always nice to have these kind of patients. The Dadvice groupies that you have. I really like groupies. Talking to them. Yeah, they're your groupies. So it's enjoyable, and it makes our experience much better. So don't be afraid to ask your doctor questions and and be nice. Like it's weird, but like if you, God forbid, and then you're all on dialysis or whatever, but ask us how our day's going too, during those rounds. Sometimes we just say hi and bye, but if you just stopped and said, hey, how's it going, and establish that relationship, it's natural. You do more for people you like. Okay. It's just true. If we like your patient, you're just going to do a lot more for that person than you're not. And don't get me wrong, I don't dislike any of my patients, but if I have a better rapport with that patient, it's going to make the experience a lot better for both people.
Yeah. Now you mentioned you create videos and they're very enjoyable and they're very short, which is awesome. Unlike my videos. How can people see your videos? Plug your stuff.
Well, you want to plug away? Okay. So you can go to, if you're on YouTube right now, go to Your Kidneys, Your Health. I'm on there. And also at Qasim Butt MD, you cannot spell my name. There's no way. but if it's on the screen right now, Qasim Butt MD. And you can look me up on LinkedIn, YouTube, LinkedIn, Facebook, Instagram. I think I'm on Twitter-ish, that's kind of hanging out there. But get on there and please interact with my videos. I just put another one out today just about EGFR, creatinine, and stuff like that. My videos are typically anywhere from 3 to 5 minutes, not too long, but I try to make it concise and simple. That way you understand. And please interact with me. Say you like the video. Say we have a question. I love that engagement. It means I did something good today. So.
Yeah. And share these videos. Share this one. Share his videos. The key to a great quality of life with kidney disease is information. We need to hear the good stuff. We need to hear from reputable people, not from someone who's pushing some pill saying, hey, buy my $100 book and buy my pills and you'll get better. No, none of that stuff works. It's just real simple, basic stuff that actually helps. Understanding how to build that relationship with your healthcare team, having a stronger relationship, learning about nutrition from a renal dietitian, and just getting out there, being more active, walking, playing with the kids, playing Frisbee with the dog, all that stuff adds up and helps. And then avoid those little bad things I do, like walk through the kitchen and grab a little snack each time, especially right after Halloween. Oh, It's difficult. I do not want to see what my A1C is.
The problem is being a dad, we have to play cleanup with those kids, don't we? Like when they have all that candy, they can't eat all that candy, right, Dad? Right, James?
I'm so good the first night. I'm like, oh, look. And our neighbors are fantastic when it comes to Halloween in our neighborhood. It's all big boxes, full size. It's all the good stuff that when I was a kid, we never got. And I'm very good that first night. No dad tax. I'm like, nope. But I'll tell you guys, it's hard. 2 weeks later, walking by 20 packs of Reese's peanut butter cups and not grabbing one.
Yeah. Almond Joy is one of my favorites too. Almond Joy, Twix. Why are we talking about this again? Man, this is just really bad.
Yeah, exactly. Not good. I don't eat until after the show, so let's not talk about that.
Well, one day you should come on with a Snickers bar and just kind of eat it while we talk about diabetes one day. So.
No, actually, I did think about starting a video where I ate a banana because so many people are afraid of potassium, and they think if they have a bite of a banana and any kidney issues that they'll like turn it into a puff of smoke or something.
Yeah, it doesn't have that much. It has potassium in it for sure, so it's about overdoing it. But yeah, bananas are delicious
it's about
to me. But
too much. It's find the right portion size, and for me, potassium isn't a problem, which is a good example of why we're all a little bit different. But yeah. Okay, enough snacks and candy talk. All right, I want to encourage all of you guys again, if you haven't done so, visit Your Kidneys, Your Health and subscribe. Also, hopefully you've already subscribed here to Dadvice TV. We are like 400 people or less away from hitting 100,000 subscribers.
Wow.
And YouTube's sending me...
Send me a picture when you get it. Send me a picture. Send me a picture. I want to see it.
Yes, I was hoping today would be the day. It'll probably be Friday or this weekend. That's when we'll hit it. And I'll be, unbelievable to make it that
Get
far.
a big chain and just hang that plaque right here on your chest, sir. Just do that. Just pull a Flavor Flav and just like walk around with that sucker.
There we go. I'll mount it to the hood of the car and drive around. All right, everybody. Thank you so much for being here. And thank you, Dr. Butt, for coming back on here again. And we'll see all of you guys in the next video. Bye, everyone.